Final position, we have a question. What is the Independent Payment Advisory Board, and what is its role? A committee in Congress that recommends employee wages in the healthcare industry. A panel created by the Affordable Care Act that consists of unelected individuals that decide what constitutes necessary care. An oversight commission at the Federal Reserve that oversees CEO pay. It is B. Okay, here is Congressman Phil Rowe.
And it's a bit of a homecoming for me. And I want to thank my good friend, Coach Tony Collins, who was a coach at Virginia State. He and I have been friends for years. He's in the audience tonight, and thanks, Tony, for being here. It's a bit of a homecoming for me because my last 10 months in the military, 9 months in the military, were up the road at Fort Eustis, Virginia. And it's where I had an opportunity to get to know my son. He was 6 weeks old when I was, you know, some of you did like I did. You went to the mailbox and there was a greetings out there, and I never will forget that. I thought it was very nice that I got this letter. And they said, you know, you remember the dream sheet, you could pick out where you wanted to go. I picked the southeastern United States. They got the direction right, they just got the continent wrong in my case. I went to Southeast Asia instead of southeastern United States. But in saying that, 58,479 people died in that conflict of Vietnam, and some of them are my very dear friends. I'll have a hard time talking about it tonight, but I know this community is suffering right now. I was so impressed when I saw how many veterans were out there in this group. And folks, I'm going to say this because I'll forget to later. There's been a lot of games played with soldiers, a lot of games played with me when I was in the military in the 60s and 70s. I was there in 73 and 74 near the DMZ in Korea in the 2nd Infantry Division. The first paycheck we ought to write to anybody in this country from the U.S. Treasury is to a soldier serving to protect our freedom. Number one. And the last paycheck we write should be to the congressmen who don't make that first paycheck yet. I've lived the American dream. I mean, America, I don't ever have to buy a lottery ticket because I won the lottery when I was born in America. I absolutely did. And I'm going to tell you just a little bit about me very briefly. I'm from the 1st Congressional District of Tennessee. That's the home of 2 presidents, the only congressional district, Andrew Jackson, Andrew Johnson, and Davy Crockett. And Davy Crockett gave one of the best speeches in the world on the House floor. He got so frustrated, and I can tell you, last week I kind of agreed with him. He said, "You can go to hell, I'm going to Texas." Well, that didn't work out too well for him, but anyway, he did go to Texas. And I truly mean that because I grew up in a 3-room house with no indoor plumbing or running water in America, and I got to go to college, I got to go to medical school, I got to form a medical practice and have a great, wonderful life because I'm an American citizen. That's why. We're all Americans. And quite frankly, I have never seen a Republican or Democrat heart attack in my life. I've never operated on a Republican or a Democrat cancer in my life. They're just people problems. And I can tell you one thing that Dr. Gingrey has experienced, and I have too. We delivered about 5,000 babies. It works out real well when you deliver your own voters, I can tell you that. I served as a local mayor of Johnson City, Tennessee, a city of 60,000 people. And we had a very simple philosophy of government. That's just spend less and you take in. Not a difficult concept. Families do that, states do that, cities do that, individuals do that. And it's time the federal government did that. And they were in there. Home one day, I was sitting in a doctor's lounge, and my wife's Pam, and she said, "What's wrong?" And I said, "No, I just got tired of complaining about what's wrong with this country. I've got to go do something about it." I practiced medicine for 31 years. We built a practice with 4 doctors and 12 employees to 84 primary care doctors, internal medicine, family practice, OBGYN, pediatrics, with 350 employees. And let me tell you what I see. Who should be making healthcare decisions in this country are physicians, patients, and their families, not the federal government, not an insurance company. saw three problems basically with the American healthcare system. One, it costs too much. I live in Appalachia, in the mountains of East Tennessee, and we don't have a very high per capita income. Good, hard-working people like the people in this room here. Hard-working people doing the right thing. It was too expensive. I'd see someone come to my office and literally you could be bankrupted by an illness. Number two, we had a segment of our population that couldn't afford it. Maybe the husband worked as a carpenter and a lot of them are out of work. Maybe the wife worked in a local diner. Maybe they make $35,000, $40,000 a year, but they can't afford health care, health insurance. And lastly, we have a liability crisis in America. And it just doesn't spread to medicine, it's all over. The cost of medicine has run up with defensive medicine to ridiculous bounds because of protecting us from lawsuits. And that needs to be changed also. So those three problems. I'm going to go through quickly. I'm going to give you the Cliff Notes version very fast of the Affordable Care Act and then get to this one little thing on iPad right quick. Basically, when I got to Congress, there were 9 physicians, and now 15. And there are 240 lawyers, and finally we have them outnumbered. But not one of us was consulted about the Affordable Health Care Act. Not one. And that was disturbing to me that a 2,500-page bill, and I read that bill front to back. It doesn't say a lot about my intelligence, but I read the entire bill. And I found some things in it that didn't set with me. And one of them is going to be the iPad bill I'm going to talk about. But what we did with that bill was we did improve coverage for some people who currently don't have it. But we took away from a group too. Medicare has been changed. I too, as Dr. Gingrey, is on Medicare. Started last year. I just turned 66 last month. Took $500 billion out of the Medicare system. They were adding 3 million people each year. $500 billion out in 10 years and 3 million more seniors. 36 million people in 10 years. If you do the math, somewhere along the line there's going to be more demand for services than there's money to pay for it. And guess what? That's going to equal 3 things in my opinion if we don't change it. One is you'll decrease access to your doctor because they're not going to be able to afford to see you. Number 2, that will change the quality of your care. And number 3, it will increase the cost of your care. Now, my section is going to be on the iPad. I read this, and the Independent Payment Advisory Board, which y'all correctly got the right answer, I picked this up, and I'd like to say that I had the answer, but quite frankly, Congressman Neal, a Democrat from Massachusetts, brought this up. And again, a good idea is a good idea. I don't care whose idea it is. And they looked this up and wrote this letter to then Speaker Pelosi, and what this is and this was in the House version of the bill. We did not get this in the House version of the bill, I should say. It was in the Senate version of the bill. The Senate version of the health care bill never did go through a committee or anything else. So this Independent Payment Advisory Board basically are 15 bureaucrats appointed by the President and confirmed by the Senate who make $165,000 a year, serve a 6-year term, and their charge is to, if Medicare hits certain targeted spending, they cut spending at that level. It stops, and there's no recourse in the law, and the Congress, unless we can get a 2/3 majority, which you know is not going to happen, cannot override this. Well, what do I see as a physician? The way I think, you have to understand how a 31-year doctor thinks. I think about anything an insurance company does or anything the government does is how does it affect the patient in the examining room that I'm seeing? How does it affect my ability to provide good health care for them? So that's what this IPAB is. We have 201 co-sponsors to get rid of that now. It's a bipartisan agreement between the Democrats and the Republicans to get rid of this very, very bad idea. Once again, thank you. Once again, I want to thank you all for this. Just to reiterate, you have sent a great representative to the U.S. Congress, Scott Rigell. I have had a pleasure in working with him. What a sharp individual, and certainly the Doctor's Caucus with Dr. Gingrey, and we'll go into question and answer now. And Dr. Bouchon, it's been a pleasure to be here tonight and look forward to your questions.